Welcome to our educational channel. Today, we're discussing cerebral aneurysms, a serious medical condition that affects many individuals worldwide. A cerebral aneurysm, also known as a brain aneurysm, is an abnormal bulge or ballooning in the wall of a blood vessel in the brain. This condition can pose significant health risks, including the potential for rupture, which can lead to life-threatening complications. Cerebral aneurysms can develop in anyone, but certain risk factors make some people more susceptible. These include high blood pressure, smoking, drug abuse, particularly cocaine, and a family history of aneurysms. Additionally, individuals with certain genetic disorders, such as Ehlers-Danlos syndrome or polycystic kidney disease, have an increased risk of developing aneurysms. Most cerebral aneurysms do not exhibit symptoms and are often discovered incidentally during imaging studies for unrelated issues. However, larger aneurysms may cause symptoms such as headaches, vision changes, or neurological deficits, depending on their location in the brain. A sudden, severe headache described as a thunderclap, or worst headache of one's life, can indicate a rupture, necessitating immediate medical attention. Diagnosis of a cerebral aneurysm typically involves imaging studies. A CT scan or MRI can help visualize the aneurysm, while a cerebral angiogram is often used to provide detailed images of the blood vessels in the brain. If a rupture occurs, a CT scan can quickly reveal bleeding, allowing for prompt treatment. Treatment options for cerebral aneurysms vary based on several factors, including the aneurysm's size, location, and whether it has ruptured. If the aneurysm is small and unruptured, doctors may recommend a watchful waiting approach, where regular monitoring is performed. For larger or symptomatic aneurysms, surgical intervention is often required. Two primary surgical methods exist: surgical clipping and endovascular coiling. Surgical clipping involves placing a metal clip at the base of the aneurysm to prevent blood flow into it, effectively sealing it off from the bloodstream. This procedure requires craniotomy, an operation that involves opening the skull. On the other hand, endovascular coiling is a minimally invasive approach where a catheter is threaded through the blood vessels to the aneurysm, and small coils are placed inside it to promote clotting and prevent bleeding. While treatment can be life-saving, risks such as infection, neurological deficits, or rebleeding can occur. Recovery from a cerebral aneurysm, whether ruptured or not, may require rehabilitation, including physical therapy, occupational therapy, and speech therapy, to help regain lost functions. Preventing cerebral aneurysms, particularly for those with existing risk factors, involves lifestyle changes, such as controlling blood pressure through diet, exercise, and medications. Refraining from smoking and avoiding drugs like cocaine are also critical steps in reducing your risk. In conclusion, cerebral aneurysms can be a serious health concern that warrants understanding and awareness. Recognizing the symptoms, understanding the risk factors, and knowing the available treatments can empower individuals to take charge of their health. If you have any concerns about your risk of cerebral aneurysms, please consult a healthcare professional for personalized advice and management. Thank you for joining us today. If you found this video informative, please like, share, and subscribe for more educational content. Stay safe and take care of your health.